welcome back to today's video. Today's video is on myth busting, some tips, and more. We'll go through like resources and whatnot. First, we'll have some terms in today's video, so I want to discuss that these terms are based on definitions in the DSM book. DSM is a book that's used by healthcare professionals, researchers, professors, and more. So the definition of OCD, anxiety, ADHD, stress, and depression is what we'll cover before getting into the video. OCD is when someone has recurring obsessions, compulsions. These obsessions and compulsions are time-consuming or cause significant distress and impairment. These are not due to the effects of a substance under a medical condition. Next up is anxiety. Now, there's many types of anxiety that you'll find out in a later video, maybe briefly in this video, but it's marked by excessive anxiety and worry about various events or activities occurring more days than not for at least 6 months. It includes symptoms like restlessness, fatigue, difficulty concentrating, irritability, sleep disturbances, impairment, ADHD. This is basically a pattern of inattention, hyperactivity, maybe like you're fidgeting. It's shown in kids and adults, ages 12 and above. Yeah. Stress is a factor. It is a significant factor in mental health, involving a state of mental or emotional strain from adverse circumstances. Symptoms like physical issues like headaches, sleep problems, anxiety, social withdrawal. Depressive disorder is characterized by a persistently depressed mood or loss of interest in activities, along with symptoms like significant weight changes, sleep disturbances, fatigue. Yeah. So busting myths. Here's a quick list of myths I'll bust before getting into tips. Okay, so OCD is basically when you just want to be clean. That's the first myth. The fact is that it involves unwanted repetitive thoughts and behaviors, and it's not just about being clean. Anxiety is just being overly worried. That's myth number 2. The fact is that anxiety is a serious condition that can affect daily functioning and physical health. ADHD only affects children. That's myth number 3, and I think I've mentioned this while going over the definitions, that ADHD is shown both in children and adults. They have different symptoms. Myth number 4, stress is always bad. Stress can be positive, which can motivate us, but chronic stress is harmful. Depression is just sadness. Depression is a complex mental health condition with various symptoms beyond sadness. So some tips on how to manage these conditions. So for OCD, list of 5 tips could be that you can create a routine, maybe using a some way of noting down your routine to how to help you manage these compulsions. You can practice mindfulness to reduce the intensity of obsessions. You could seek cognitive behavioral therapy for long-term management. You could gradually expose yourself to feared situations in a controlled way, which is called exposure therapy. And lastly, you could use stress management techniques like deep breathing or yoga. Next up is anxiety. Anxiety includes triggers such as social situations, work, school, health concerns, financial stress. So a tip could be to keeping a journal to identify and understand your triggers, developing coping strategies for different triggers. Some techniques for breathing is for the 4-7-8, which is breathing in for 4 seconds, holding it, and then exhaling for 8 seconds. Ground exercise, identify 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste, which identifies your 5 senses. Progressive muscle tension, which is tense and relax different muscle groups, starting from your toes and working up to your head. ADHD, you could use a planner or digital calendar for daily tasks to help remind you of what your tasks are. You could break your tasks into smaller, manageable steps. You could utilize tools like timers to stay on track. Create a distraction-free workspace, so clearing up any clutter. You could prioritize tasks and tackle the most important ones first. ADHD can enhance creativity and problem-solving skills. Many successful individuals with ADHD use their unique perspectives to their advantage. So you should embrace your strengths and find ways to leverage them to help you in your personal and professional life. For stress, you could take a short walk, or change your scenery. Maybe if you're indoors, you could go outdoors. Maybe if you're, just change your environment, from maybe like being, or maybe just like a brief walk can help clear your mind and reduce stress. Another way is to do some quick stretching or physical activity. Stretching can relieve muscle tension. Listening to music or favorite podcasts. Some people find music to be calming and improve your mood. Depression could be helped in these 5 ways. You could engage in a hobby that you enjoy. You could connect with friends or family, even if just for a few minutes. You could establish a simple routine to add structure to your day. You could set small achievable goals to build a sense of accomplishment. You could practice self-compassion and be kind. So how do people live with this condition, and how do you support someone? OCD, so people spend significant time on compulsions like checking or cleaning. Their challenges could be intrusive thoughts and repetitive behaviors can disrupt daily activities. What they can do is they can manage symptoms with therapy, medication, and support. They cannot just simply stop their compulsions without treatment. So what you should say to someone is, I'm here for you, how can I support you? And don't say, just stop thinking about it or you're overreacting. Helpful actions could be to encourage seeking professional help, being patient and understanding. Unhelpful actions could be participating in or reinforcing compulsions, dismissing their experiences. For anxiety, people spend most of their time worrying, having physical symptoms like sweating or rapid heartbeat. Challenges are that avoidance of triggering situations, difficulty concentrating. They can do what they can do is they can use coping strategies. The people cope in many different ways. The examples I've shown in this slide are just the more common ones, but you can cope however you find to be helpful. What they cannot do is just relax on command. Anxiety is not something that's easily controlled. The strategies so what you should say to someone is, I understand that this is hard for you, take your time. Don't say calm down, it's all in your head. Helpful actions can be offering a calming presence, assisting in finding professional help. Unhelpful actions can be minimizing their feelings, pushing them into uncomfortable situations. ADHD, so they have difficulty focusing, impulsivity, and hyperactivity. So their challenges are staying organized, meeting deadlines, and following through on tasks. What they can do is thrive in structured environments, excel in creative tasks, and leverage unique strengths. They cannot simply pay attention or sit still. So do say to someone, let's find a way to go through this. You have unique strengths. Don't say you just try harder. Why can't you sit still? Helpful actions can be helping them with the organization, being patient, and encouraging professional help. Unhelpful actions can be criticizing their behavior, expecting them to conform without support. Stress, people with stress feeling overwhelmed. They have physical symptoms like headaches or fatigue. Their challenge Their challenges are managing multiple responsibilities, finding time for self-care. What they can do is implement stress management techniques, find balance with proper strategies. They cannot just avoid stress entirely. It's a natural part of life that needs to be managed. So do say to someone, I'm here for you. I'm here to help. It's okay to take a break. Don't say everyone gets stressed, just deal with that you're overreacting. Helpful actions can be to offer practical help, encourage relaxation techniques. Unhelpful actions can be adding to their stress, dismissing their need for a break. Depression. People with depression have persistent sadness, loss of interest in activities, and fatigue. Challenges they face are motivating themselves to maintaining daily routines and social withdrawal. They can do is improve with treatment, engage in fulfilling activities, and find joy with support. They cannot What they cannot do is simply snap out of their depression, which requires professional intervention. So do say, I care about you, what can I do to help? And don't say, just cheer up, you have nothing to be sad about. Helpful actions can be offering to listen, encouraging